more than 3 million Americans receive care or reside in nursing homes every year. As the older adult population in the United States continues to grow, it's anticipated that the number of people entering nursing homes will grow too. Antibiotic use has saved millions of human lives in the last 80 years by treating deadly infectious diseases. However, among older adults, antibiotic use can be associated with high rates of adverse events and can lead to clinically significant drug interactions. The risks of acquiring Clostridioides difficile infection and subsequent complications, including hospitalization and death, are greatest in older adults. Antibiotic exposure is one of the most important risk factors associated with the development of antibiotic resistance. Antibiotic-resistant infections are associated with higher rates of mortality and worse outcomes. Nursing home residents colonized with antibiotic-resistant organisms can also serve as reservoir for spread of resistant organisms to others. Longitudinal studies have shown that as many as 70% of nursing home residents will be prescribed one or more courses of systemic antibiotics over the course of a year. Not only is antibiotic use high, but 40 to 75% of antibiotics prescribed in nursing homes may be inappropriate. To assess appropriateness, consider the 5 Ds of antibiotic prescribing: diagnosis, drug, dose, duration, and de-escalation. Examples of inappropriate prescribing include the use of an antibiotic for a viral infection or asymptomatic bacteriuria, the lack of dose adjustment for renal function, and failing to adjust the antibiotic based on laboratory results and clinical response. Prescribers should ensure that documentation in the medical record reflects the 5 Ds of appropriate antibiotic prescribing. Antibiotic stewardship is a set of commitments and actions designed to optimize the treatment of infections while reducing the adverse events and harms associated with antibiotic use. There is a strong case for making antibiotic stewardship an organizational priority in nursing homes. Antibiotic stewardship can be included in activities that are intended to improve quality and performance. Stewardship efforts include the following: measuring antibiotic prescribing, improving antibiotic prescribing so that the antibiotics are only prescribed and used when needed, and ensuring prompt initiation of the right antibiotics when they are needed, and ensuring that the right drug, dose, and duration are selected. As in the outpatient and hospital settings, CDC recommends that all nursing homes take steps to improve antibiotic prescribing practices and reduce inappropriate use. CDC's core elements of antibiotic stewardship for nursing homes, released in September of 2015, adapts the CDC core elements of hospital antibiotic stewardship into practical ways to implement stewardship activities in nursing homes. The core elements provide a framework for assessing current practices and initiating new stewardship activities, and for monitoring and reporting and improving antibiotic use. That is why it is important that partners such as the Maryland Department of Health and the University of Maryland, Baltimore continue to collaborate to improve antibiotic use across all healthcare settings.